First off, I do not like politics. I do not identify with or even respect the Democratic Party or the Republican Party. This virus is an issue for all humans. Second, COVID-19 is not a conspiracy. It is not fake. I hope to give a reasonable and evidence-based analysis on the severity of this new coronavirus. The purpose of this video is to combat fear. How many people are actually dying from COVID-19? Is this virus far less dangerous than we are being led to believe? Let us start with the protocol with which we count death.
Clear in terms of the definition of people dying of COVID. So the case definition is very simplistic. It means at the time of death, it was a COVID positive diagnosis. So that means that if you were in hospice and had already been given, a few weeks to live, and then you also were found to have COVID, that would be counted as a COVID death. It means that even if you died of a clear alternate cause, but you had COVID at the same time, it's still listed as a COVID death. So everyone who's listed as a COVID death doesn't mean that that was the cause of the death, but they had COVID at the time of death. I hope that's helpful.
Can you talk about your concerns about deaths being misreported?
So I think in this country, we've taken a very liberal approach to mortality. The intent is right now that if someone dies with COVID-19, we are counting that as a COVID-19 death.
This unscientific and unfair practice of counting deaths is an issue all over the world.
Is it possible that all these doctors are, quote, in on changing all these death certificates?
No, it's a policy, it's a government policy. If you go to Italy, you can see that it's by government order. They tell you that if the patient had the coronavirus, never mind any other reason, you must put him in the coronavirus list. So the numbers are lying, absolutely.
This is Professor Walter Ricciardi of Italy, scientific advisor to Italy's Minister of Health. On March 23rd, he had this to say in an interview with The Telegraph. The way in which we code deaths in our country is very generous in the sense that all the people who die in hospitals with the coronavirus are deemed to be dying of the coronavirus. On re-evaluation by the National Institute of Health, only 12% of death certificates have shown a direct causality from coronavirus, while 88% of patients who have died have at least one premorbidity. Many had 2 or 3.
And I'm getting documents from Italy showing that many of the COVID deaths were either dead before they were tested, or else they had up to 3 other conditions. So there's nothing wrong with this. People die for all sorts of reasons, but the news should be stressing this, and maybe they should be counting it as a 0.1 COVID death. Countries seem to be racing to have as many COVID deaths as they could.
I double-checked this with a friend that is involved in end-of-life care at a hospital in California. The medical worker informed me that it is actually worse than I thought. You don't even need to have tested positive for COVID to count as a COVID death. You just have to have symptoms of COVID to be counted as a COVID death.
How to count COVID deaths relating to that last issue we just raised. In cases where a definite diagnosis of COVID cannot be made, but is suspected or likely, like the circumstances are compelling with a reasonable degree of certainty, it is acceptable to report COVID-19 on a death certificate as probable or presumed.
Well, let's just take influenza. If I have a patient died a month ago, had fever, cough, and died after 3 days, and maybe had been an elderly, fragile individual, and there happened to be an influenza epidemic around our community, I wouldn't put influenza on the death certificate, and I've never been encouraged to do so. I would put probably respiratory arrest would be the top line, and the underlying cause of disease would be pneumonia. And in the contributing factors, I might well put emphysema or congestive heart failure. But I would never put influenza down as the underlying cause of death. And yet that's what we're being asked to do here. Right now, Medicare has determined that if you have a COVID-19 admission to the hospital, you'll get paid $13,000. If that COVID-19 patient goes on a ventilator, you get $39,000, 3 times as much. Nobody can tell me after 35 years in the world of medicine that sometimes those kinds of things impact on what we do.
That figure of 39,000 that he mentioned for the ventilator to treat COVID patients is actually closer to 40,000 on average, according to the Kaiser Family Foundation.
Dear fellow citizens, I am a medical microbiologist and infectious disease epidemiologist who served for 22 years as chairman of the Institute of Medical Microbiology and Hygiene, Mainz University. My life has been devoted to researching the pathogenesis, diagnosis, and therapy of infectious diseases. My intent was to channel the heated discussions back and down to a sound scientific basis for the sake of the entire community in this country. In my conviction, the terrible error made in the entire world is that whenever the virus is detected in a deceased, it is automatically assigned as the cause of death and enters the awful list of the corona dead. This violates a basic principle in medicine. It simply must be established that a patient dies because of and not simply with a virus. This is explicitly stated in the German medical guidelines, which are, however, not heeded in the case of COVID-19. Hence my question to the Chancellor, has Germany simply followed the global trend of unscientifically categorizing and defining COVID-19 related deaths? I say once again, the simple and trivial presence of the virus must never ever qualify it to enter the register of COVID deaths. My dear fellow citizens, the reports from Italy, as sad and depressing as they are, cannot and must not become the basis of our own measures in Germany. I do not stand alone. Many of my colleagues in this country have openly voiced their similar opinion.
Let's talk about the actual data regarding the number of people that are infected and the percentage of those infected that are dying. We have already learned that the death numbers are inflated. In Italy's case, upon re-evaluation, only 12% of total COVID deaths could actually be attributed to COVID. We don't know just how incorrect our death numbers are in the United States, but keep this concept in mind as we get into death percentages. The low percentages that you are about to hear should very likely be much lower. Professor John Ioannidis is a professor of medicine, health research and policy, biomedical data science, and statistics, chair in disease prevention, member of the U.S. Academy of Medicine. He is one of the most cited medical researchers of all time.
Dr. Ioannidis, when we spoke to you on March 23rd, you said we needed more data before we could ascertain what was happening. Since then, you've been busily gathering that data and have published 3 studies. Let's start with the latest one, which you entitle COVID-19 Antibody Seroprevalence in Santa Clara County, California. What was the purpose of that study, and what did you discover?
This study aimed to generate an estimate of how many people in Santa Clara County have been infected with the virus. And the way to find out is to try to see whether they have developed antibodies to SARS-CoV-2. So we had a sample of residents in Santa Clara County evaluated for the presence of antibodies. And the sample was 3,300 people who came to be tested. We estimated that based on what we saw, between 2.5 and 4.2% of the population of the county has antibodies, which is an indication that they have been infected with the virus a while ago.
What are your conclusions based on your study?
If you compare the numbers that we estimate to have been infected, which vary from 48,000 to 81,000, versus the number of documented cases that would correspond to the same time horizon around April 1st, when we had 956 cases documented in Santa Clara County, we realized that the number of infected people is somewhere between 50 and 85 times more compared to what we thought, compared to what had been documented. Immediately, that means that the infection fatality rate, the chance of dying, the probability of dying if you are infected, diminishes by 50 to 85 fold, because the denominator in the calculation becomes 50 to 85 fold bigger. Our data suggests that COVID-19 has an infection fatality rate that is in the same ballpark as seasonal influenza. It suggests that even though this is a very serious problem, we should not fear.
There was some controversy regarding the testing pool from the Stanford study. Here is another test from USC in Los Angeles with a more randomized testing pool. The test results were nearly the same and line up with tests from around the world.
When we tested about 863 individuals who were representative of LA County, about 4.1% of them tested positive. You compare this to the confirmed cases of COVID-19 in Los Angeles County, what we get is that the number of true infections based on the study is 40 times larger than the number of confirmed cases. So we could say maybe the good news is that the fatality rate is slightly or is lower than what we thought it would be.
Is it true to say that this is a randomized sample, which I know is the gold standard for these type of community surveillance studies?
So we worked with a market research firm called the LRW Group. They have a database of email addresses as well as phone numbers of people residing in Los Angeles County. We picked a random number of emails or phone numbers to contact for people to help to participate in this study. It was a random sample picked from this database maintained by the market research firm LRW. And then we set quotas based on the demographic distribution of LA County. So we wanted our sample to try to mimic LA County in terms of its age distribution, gender distribution, race, ethnicity.
We did a 3,000-person survey, which is fairly extensive, all throughout the state. Statewide, it was about 14% of the people had the antibodies, which means 14% of the people had the virus. That's about 2.7 million people in our state. New York City was close to 20%. Which was surprising. The other good news is, we talk about the death rate. We have about 15,000 people who have died in New York. It's 15,000 on a much larger denominator. So the death rate is like 0.5. The normal flu is 0.1 to 0.3.
The study focused on one of the hardest hit regions in Germany called Heinsberg. It found that 15% of the population had antibodies for the virus in this area, suggesting they'd had the disease already, with a mortality rate of 0.37%. That's less than 1/5 of the mortality rate considered in Germany as a whole. Joining us now, the scientist behind this research, Professor Heinrich Streeck. He's a director of the Institute of Virology and the Institute for HIV Research at the University of Bonn. I guess so the starting point clearly is a very concentrated area of infection in Germany where you've done a lot of testing, and the encouraging result of that is a much lower death rate than previously thought.
Yes, so what we did was a representative study within this area where we had a high prevalence of cases already. So it got hit pretty hard by COVID-19. But the surprising part, what we found was that there were 15% in that population that didn't know that they had an infection. And overall, that we are calculating a case fatality rate, so how many people are actually dying of that disease in that population, is 0.37%. So this case fatality rate is not actually different probably in other countries, but that we can assume a pretty high rate of infections that are asymptomatic.
I like to think that Iceland has less political corruption. They tend to stay away from global politics. I was curious to see where they were at on death as I suspected they would not be greatly inflating their death numbers like other countries. As you can see, according to Google, they have had 10 deaths. 10 is just 0.5% of their confirmed 1,801 infections as of May 8th. Remember, this virus is very weak in that a lot of people get it and do not even have symptoms, but it is very contagious. We have already learned that when testing is done, it is found that actual population infection is anywhere from 30 times to 80 times higher than expected. Let's go on the low end and say that the infection rate is just 30 times higher. 1,801 times 30 brings us to 54,030 infections. The chances from dying from COVID in Iceland, if you are infected, should be around 0.018%. That's 10 deaths out of 54,030 infected people.
The only reason for this video is the obligation to serve science and our community. The decisive question is, do we know enough to justify the massive measures that violate human rights in our free democratic society? Implementation of the current draconian measures that so extremely restrict fundamental rights can only be justified if there is reason to fear that a truly exponentially dangerous virus is threatening us. Do any scientifically sound data exist to support this contention for COVID-19? I assert that the answer is simply no. To gauge the true danger of the virus, what is the type of data we need? Here are common coronaviruses that we live with every day. Here is COVID-19. What we need are, say, 10,000 patients, all with respiratory tract disease, that are infected with common coronaviruses, and 10,000 infected with COVID-19, all really with respiratory tract disease, nothing else. Then we need to ask how many die in this group and how many in that. If the mortality is similar in both, then clearly they are similarly dangerous or less dangerous. If the number here is higher, then obviously the virus is more dangerous. If the number is much, much, much higher, then obviously the virus is much, much, much more dangerous. You will ask me, has there been such a study? And I answer no, until March 19th, 2020, when the first study ever appeared from our French colleagues that addressed this central question. What do you think they reported? The mortality in both groups was similar. COVID-19 did not differ in dangerousness from its everyday relatives, like for instance its alarming predecessors, SARS and MERS, that were really deadly, or like the flu virus that plagued the world 2 years ago that was 50 or 100 times more deadly than annual flu viruses, which this year have caused around 300 deaths. 2 years ago, we were horrified at more than 20,000 flu deaths in Germany, and yet no stringent preventative measures were implemented at all, and this was correct and reasonable. Now imagine that COVID-19 will and has actually already been exposed as a virus with perhaps somewhat but never ever extremely higher deadly potency than everyday coronaviruses.
Perhaps the most interesting study in the world is that of Sweden. While most countries are under strict quarantine lockdowns, Sweden has had an extremely mild approach. Life goes on in a near normal fashion. The whole world is watching to see how it turns out for them. They have faced harsh criticism from some countries, including the USA, whose media loves to project fear. It has been said that their death numbers are higher than the countries around them. I think we should hear what they have to say. Meet Professor Johan Giesecke.
I used to be an infectious disease clinical doctor and worked a lot with AIDS patients during the 1980s. And that's what put me into epidemiology. And then I became state epidemiologist for Sweden, which means having control over all the infectious diseases.
Which is the job that Anders Tegnell currently has.
So I actually hired him 20 years ago, and then I was his boss, and now he's my boss. But it's working actually quite well.
You then became chief scientist at the European Centre for Disease Control.
Yep.
You think we're on the wrong track because we went to lockdown?
Yes.
Sweden has had, I mean, it's an interesting case, Sweden, because You haven't really had any form of lockdown. It's hard to assess yet whether that has been successful or not. But how are your figures comparing, for example, in infections and deaths to your immediate Scandinavian neighbours?
They're higher. But one very important thing, I think we should wait a year in comparing deaths in different countries, because the cases that have died in Sweden will be the ones similar to the ones who, when you open your lockdown, you'll have more deaths. And in the end, I think they will be about the same in each country.
So you think the problem with the lockdown is that eventually you have to unlock it?
Yeah, I mean, you postpone what's happening.
Humans are creatures that need community. You cannot keep free people locked up. Even if you did, this virus is too contagious to keep away. Johan says that we are just delaying the inevitable. Society will be exposed to this sickness, as we have always been exposed to sicknesses. Perhaps many countries have been short-sighted, whereas Sweden is considering the future and the devastation that a lockdown has on a population. As societies open up and people leave their homes, those that would have had a bad reaction to the virus before will have that reaction a few months later anyways.
In a democratic Western country, you can't shut people up for 18 months. That's impossible. You can do it in China, but you can't do it in England.
Do you think that you will have, there will be a different economic effect in Sweden as a result of not locking down?
We shouldn't exaggerate this thing with the legal lockdown and the soft lockdown. The result in practice is very similar, actually. Yes, I think that the Swedish economy will come out it will be weakened, but not as weakened as in many other countries.
Dr. Tegnell, thank you so much for joining us on the Daily Social Distancing Show. You are chatting to us from a train station right now, is that correct?
Yeah, that's correct. Train station in Stockholm, Sweden.
Tell me about what's happening in Sweden. What have you seen from the numbers in and around the coronavirus?
I think in Sweden, like in many countries, it's different in different parts of Sweden, even if it's a small country. I mean, Stockholm and the surrounding areas, which is about half the population of Sweden, slightly less, we have had quite a big number of people being ill in the last 2 months. Mm-hmm. While many other parts of Sweden, including the big cities on the west coast and in the south, have had not very many cases at all so far. But in Stockholm and the surrounding area, we have had a fair amount of cases. We think we're up to about a quarter of the population who has been infected so far. That has been done in a fairly slow manner. So the number of cases have been fairly constant for at least 1 month by now, which means that the healthcare, who has transitioned a lot, changed a lot. They do very different things today than what they used to do. But they have been kept on working, and they have always been beds free. Everybody in Sweden who needs a hospital bed have gotten a hospital bed for COVID-19 or for other diseases, so it's kept on working. And intensive care has even had at least 20% of the beds free at any given time. So in that respect, the strategy has been successful.
What are you hoping herd immunity will achieve for Sweden?
I think complete herd immunity, we're not sure any country will ever achieve, because that means that the disease goes away, and I don't really see this disease going away. But even some immunity in the population, like the 20-25% that we are reaching now, will have a great effect on the speed of spread.
Well, I think we'll probably have to beat the current epidemic without a vaccine. Realistically, we're not going to sit still in our houses without any social contact for the next 12 to 18 months. And we'll probably have to let the restrictions relax gradually, let the virus spread through the community gradually while we can control it, and then hope that we get herd immunity.
Dr. Knut Witowski is head of biostatistics, epidemiology, and research design at the Rockefeller University. He's been published in the American Journal of Public Health. He's a consultant at the New York Academy of Medicine. He's a guest researcher for Centers for Disease Control.
With all respiratory diseases, the only thing that stops the disease is herd immunity. About 80% of the people need to have had contact with the virus, and the majority of them won't even have recognized that they were infected, or they had very, very mild symptoms, especially if they are children.
Consider the physical evidence in the footage of Swedish people going about their lives. If this virus causes mass devastation when people are allowed to be free, would these people be going about their lives in such a normal fashion? Sweden seemed to have been immune to the early Chinese influence in protocols when dealing with COVID-19. Sweden seemed to be immune to fear-mongering, bullying, and short-sighted perspectives.
Why do you think you're such a loner in this, and why do you think more countries didn't follow the route you did?
Because politicians want to show action, decisiveness, and do something. I think my main favorite useless intervention is spraying the sidewalks in Asia with chloride. That doesn't help anyone. It's an environmental problem, but not a contagious disease problem. But that shows that the authorities are doing something.
The other problem in many countries is that the lockdown occurred without any thinking about an exit strategy. Sweden has put people at the base of this, and I think that's most important for a lasting and sustainable intervention.
People look at the numbers of countries around Sweden and they go, their death rates is far lower in terms of coronavirus. Sweden's numbers are higher. But then if you look at other countries like Italy and Spain, etc., they have higher numbers than Sweden. So when you say Sweden is successful, how do you measure that success? Are you just looking at the numbers of death, or are you looking at it holistically? What does that mean, Sweden is successful?
And it's very much related to our elderly people's homes who have proven to be extremely susceptible to this disease. And we know that there's a number of things quality-wise that needs to be addressed in those, and we are addressing them with a lot of other agencies involved, and we're seeing some improvements. But our death toll has very much to do with that. In other aspects, it's many of the things have worked, I think, reasonably well. And I think the good thing is that we've been able to keep schools open. Keeping schools open is very important for children and children's health. We know that for sure. We have been able to keep a lot of people working, and we know that losing your work is very dangerous to your health. So we've been trying to take a slightly more holistic approach to this than maybe some other countries have done.
86% of the fatalities in Sweden due to the disease affected people over 70. Why did countries get it so wrong when it comes to the elderly population?
I don't think you can prevent that, actually. It spreads. It's too contagious, this disease.
The criticism that you will hear repeatedly against Sweden is that they have higher death rates than their neighbors, but it is not that simple. As of May 5th, 2020, Norway has around 200 deaths. Denmark has around 500 deaths. Finland has around 260. Sweden has around 3,000. It is very convenient that all three countries besides Sweden are in the 5 million range for population. Sweden has double the population with 10 million. In order to compare apples to apples, we have to cut Sweden's population in half so that all four countries are on an even playing field. If we cut Sweden's numbers in half, then that puts them at about 1,600 deaths. If Norway, Finland, and Denmark had the mild protocols in place that Sweden has had this whole time, do you think it would be reasonable to say that the three countries would have 1,000 more deaths? That would put them right on par with Sweden. What do you think will happen when these other countries inevitably open up to the level of freedom that Sweden has had this whole time? They are going to start catching up with their infection rate. In the end, there will be little difference between all of these countries. Sweden has a large nursing home population, as they have one of the top 10 oldest populations on Earth. Over 80% of the deaths have been of elderly people. Let's keep it in perspective. In the entire country of Sweden, about 3,000 people have died. Over 80% of them were elderly, and many of them not in their best health. These were people that were closer to the end of natural life. The loss of life should never be taken lightly, but in a global pandemic that has entire nations frozen in fear, 600 untimely deaths for a whole country should not cripple a nation. And for Sweden, it has not crippled them.
If somebody said to you, Dr. Tegnell, your numbers, we understand your methodology, we understand everything you're trying to do, but having tripled the death rates of countries like Norway and Denmark means that, you've put some lives above other lives. Do you think that that's a decision epidemiologists / governments need to make? Is it an easy decision to make? Because I don't think anybody has the right answer in this regard, but I'd like to know how you and your team got to that place where you said, you know what, it's worth the risk. We want kids to be in schools, we want people to still be working, and we understand that might lead us to have a higher death toll initially.
No, I don't think we never really calculated with a higher death toll initially. I must say that's not right. I mean, we calculated on more people being sick, but the death toll really came as a surprise to us. We really thought that our elderly homes would be much better at keeping the disease outside of them than they actually been in here. Not that Sweden is the only country with this problem. I mean, many countries in Europe have the problem with elderly homes. So obviously, it's very difficult to keep the disease away from there. We are not putting anybody's life above everybody else's lives. That's not the way we are working. We are really trying to keep public health as good as possible in this troublesome time.
That's really interesting, because that's not how it's being reported in many places. I'm glad you said that. It's interesting to hear it from somebody in Sweden who's part of this directly.
We, or the Swedish government, decided early in January that the measures we should take against the pandemic should be evidence-based. And when you start looking around for the measures that are being taken now by different countries, you find that very few of them have the shred of evidence base.
Let's finish up the topic of Sweden with a recent address from Dr. Anders Tegnell, giving an update on their situation as they are reaching the end of their epidemic.
The epidemic has been very much concentrated to Stockholm, our most densely populated area, and the densely populated surrounding regions, and not so much of an epidemic in the rest of the country. The epidemic in Stockholm is clearly slowing down. We have considerably fewer admissions to ICU. The mortality rates are coming down. We had an average of almost 100 cases a day for a while. Now we're down to slightly more than 70. And we do believe that part of the reason why the epidemic is slowing down here is that we're having a considerable part of the population is now immune.
Fear is the second easiest way to manipulate the masses. Hunger is the first. And nothing is more scary to people than the threat of death. Let's talk about numbers for a moment. This is why the death toll numbers for COVID are being paraded before your eyes on every medium imaginable, all day, every day, and without end. This constant barrage of death statistics is totally unprecedented. In other words, we've never published death toll counts like this before for anything else in history. This is basic analysis from publicly available documentation. I will include references in the notes. According to the CDC, who I don't trust or believe, but we're going to use their numbers from 2017, the top 10 causes of death in America are: remarkably, Johns Hopkins University published a study demonstrating that the third leading cause of death in America is medical errors. The study shows that between 250,000 and 440,000 deaths in America are basically caused by doctors and bad medical protocols in healthcare facilities. If the media showed the death numbers due to doctors all day, every day, people would be terrified of doctors like they are of COVID. Maybe even more, since doctors kill way more people. As of May 9th, the total number of deaths being attributed to COVID-19 in New York is 14,753. However, their own data sheet demonstrates that of those 14,753 deaths being attributed to COVID, only 94 of them could actually be attributed to COVID alone. That's 94 out of 14,753. That is 0.637%. It is not even 1% of the deaths. The other 14,659 people who died had other life-threatening health conditions, and they actually list those conditions on the bottom of the page. Let's make those bigger so we can see. The items listed on screen are actually on the top 10 list of the causes of death in America. So 7 out of the top 10 causes of death in America are now being attributed to COVID deaths. This means if you go to a New York hospital with diabetes and heart disease, and then you die of a heart attack, your death can be attributed to COVID-19. This is similar to what we saw in Italy's numbers as well. The numbers were being falsely attributed to COVID-19 even when the people dying were dying with 3 or more other morbidities. An 80-year-old obese Italian with lung disease, pneumonia, and cancer all at the same time had his death listed in international news as COVID. How's that for accuracy in reporting? So what about deaths from heart disease and strokes? 2 leading causes of death in America. Well, remarkably, people have stopped dying from these 2 leading causes. Though at this time, it is nearly impossible to get a year-over-year statistical reference check because those numbers would demonstrate empirically that all or some of the normal annual death toll has been rolled into COVID-19 death toll numbers. I doubt we'll ever get those numbers accurately because the obvious conclusion will be devastating to the coronavirus narrative. Just so you know, the current protocol for putting a COVID-19 patient on a ventilator includes medically inducing a state of paralysis and sedation similar to being in a coma, so that the doctor can force a tube down one's throat and into the lungs in order to use a machine, the ventilator, to mechanically breathe on the patient's behalf. You must be medically paralyzed in order to have this procedure done. And guess what? It's killing people. Doctors all over America are now questioning these protocols, and many are refusing to use these protocols anymore, as many of them are taking their oath to do no harm very seriously. It shouldn't come as a surprise, since we already know that doctors and medical errors are the 3rd leading cause of death in America. But the evidence is mounting that current medical protocols for the use of ventilators are actually killing more COVID-19 patients than anything else. This report, published in the well-respected Lancet Medical Journal, demonstrates that 86% of COVID-19 patients put on a ventilator die. A new report has that number at almost 90%. The medical community is obviously blaming these deaths on COVID and not on the improper use of ventilators. Michael Yo is one of those rare healthy people that became very ill with COVID. In this interview from around May 10th, he describes his experience with a ventilator.
On a ventilator?
No. My doctor saved my life. My doctor said, if we put you on a ventilator, he says, because a nurse brought it up, should we put him on a ventilator? And he goes, no way. If we put him on a ventilator, he's going to die. If you've heard in New York, 80% of the people put on ventilators die.
I've heard that. I've heard that being speculated by other doctors as well, and it's very controversial because so many doctors put people on ventilators, and the last thing they want to hear is another doctor saying, "You put someone on a ventilator, they'll die." But
my doctor said that straight up in the room in front of me to the nurses.
Shit.
Like, if we put him on it, he's going to die. The dude saved my life, because if I went on a ventilator, bro, I may not be here. Because
when you go on a ventilator, they kind of
knock
put
you out. Yeah, you're unconscious.
We are constantly reminded by celebrities, YouTube, news networks, etc., that we must stay home to flatten the curve. If we did not quarantine in the USA, then hospitals would have been overrun. I think people will debate about this for a long time, as the vast majority of hospitals in the US did not receive a rush of COVID patients, but instead had a lack of COVID patients. The real devastation to most hospitals came in the surprising lack of any patients in general. Many hospitals expanded their ICUs and COVID treatment wards, but never saw them used. The same goes for the overflow facilities that were set up around the country. As of May, a majority of them have not seen one patient. They were supposed to set up one of these overflow facilities in my city over a month ago, but faded into the bushes.
There is good news. A lot of these numbers of sick and very sick people just aren't materializing. Hospitals aren't being overrun. A lot of these hospital expansions and field hospitals are empty. Certainly they are in New York. New York sees a lot of patients, but they turned convention centers into field hospitals, and there's no patients in there. The U.S. Navy hospital ships only have a few patients on board at all. So the numbers of sick people really hasn't materialized. What we suspect that we're seeing is that this disease is far more contagious, but probably far less lethal than anybody thought.
The two sides of the debate will be: 1. Hospitals were empty because the virus was not nearly as bad as we were led to believe. 2. Hospitals were empty because we had a strict quarantine. I am going to suggest that both sides are correct, to a degree. But first, a lot of the fear regarding the virus in the United States always comes back to New York. This could be the topic for another 30-minute video, but let's just all agree that New York is just one state, one city in an enormous country. Let's talk about the rest of the United States and just set New York aside, as New York is a rare extreme, an anomaly. There are a few cities that had some trouble with hospital capacity. New Orleans comes to mind, but it is difficult to think of many. Let's remember that this is a huge country with 19,495 cities. There is not a one-size-fits-all approach to this situation for every city, county, or state. Unfortunately, that's how our government approached the response to COVID.
Ken, a quick survey of Bay Area emergency rooms really tells the story. Patients, even those with life-threatening conditions, staying far away. It's not just the virus that's spreading, it's the fear.
There have been other serious issues in hospitals: layoffs for staff, furloughs, lack of supplies, extreme lack of income, hospitals closing down outright, etc. What do I suggest? State governments should be paying close attention to how counties are performing and then opening them up as we gain perspective on the performance of hospitals. Most counties in the United States could have been in a similar situation to Sweden this whole time and never had any issue with their hospitals being overrun. For over a month now, we have had the data to know that we are not being overrun in most counties, but we still sit idle in a quarantine. Perhaps it does not seem possible for some counties to open and others stay closed. But let me tell you, it is already happening against governor's orders in California. A handful of counties have defied the governor's stay-at-home orders and have voted within their local governments to open up their counties. You can go to the mall in these counties right now if you want to buy an unessential Orange Julius from some unessential workers. I think that I can actually understand the reasoning that the government used in its decision to so quickly slam the door on this quarantine. However, we are still in a quarantine after observing for over 6 weeks that most hospitals were never even close to being overrun. This is unacceptable. The damage done to the physical health of our people, their freedoms, financial health, and mental health have been catastrophic. People with health issues, like myself, have been unable to receive treatment and suffer from their ailments. Perhaps a strict quarantine may have made sense for a small minority of counties in the USA. It does not make sense for most. Let's talk about my county in California and how dangerous COVID has been here. We have about 1 million people and have had 9 deaths in the whole county. Using the information we learned in the first 5 minutes of this video regarding how COVID deaths are counted, is it possible that we have actually had 0 deaths due to COVID instead of 9? Have we had the correct reaction to these 0 to 9 deaths out of 1 million people in my county? As we lay off or furlough large percentages of our hospital staff, arrest people for insane reasons, shut down and fine small businesses that offer the same items or services as big corporations that are allowed to stay open, many of which have had record-breaking sales while families with local stores and their employees lose everything. Watch suicide rates skyrocket, release rapists and child molesters from prison, allow non-COVID health issues to go untreated, and allow constitutional rights to be violated. It becomes clear that we have made a big mistake. This mistake is not only true for my county, but for most other counties in this country. Does it seem reasonable to say that the small number of counties with hospitals reaching capacity should have carried out this strict quarantine, and the others that showed no capacity issues at all should have taken very mild measures? We will most all get this virus at some point, just like most of us adults have had the flu several times in our life. You will come in contact with this virus, and your immune system will kill it. You will move on with your life. We cannot cower waiting for a vaccine to save us. In order to release a vaccine safely, it should take years of trials. Even then, it may just give temporary immunity or may not be effective on you at all. You may even have a bad reaction to the vaccine. There has never been a successful vaccine for any coronavirus known to man.
Well, we could try and shortcut the process and cut out some of the safety testing, but the risk then is that we end up with a vaccine like some of the ones that were developed for SARS, where the vaccine actually makes the risk of getting sick greater rather than less.
It is wise to only trust those that earn your trust. People like members of your family, friends, and co-workers, etc. If you had a friend that had consistently lied to you and cheated you over the years, would you continue to trust them? Would you trust them with your money, your health, the safety of your loved ones? We must always stay skeptical of our government and the government agencies in our country. Have they not consistently lied and cheated us over the years? I am not saying that they are unable to do good. I am just saying that we must always maintain a healthy amount of skepticism towards them. They must prove themselves in every single act. The same goes for the media. In this internet age where we all carry a glowing screen with us everywhere we go, we are easy to manipulate. The news is not a social service. It is a business. And right now, business is booming. They thrive on our fear and censor those with dissenting opinions. I'm looking at you, Google and YouTube.
Can you imagine a time where Americans carry certificates of immunity?
You know, that's possible. I mean, it's one of those things that we talk about. This is something that's being discussed. I think it might actually have some merit.
Wait, what?
If back to normal means acting like there never was a coronavirus problem, I don't think that's going to happen until we do have a situation where you can completely protect the population. And with the fact that I feel confident that over a period of time we will get a good vaccine, that we will never have to get back to where we are right back now. So if that means getting back to normal, then we'll get back to normal.
Wait, what?
We go through multiple cycles of influenza. There's always a degree of background immunity in the population. I mean, that will ultimately happen if we get a situation where we get back to normal. Now, I hope we don't have so many people infected that we actually have that herd immunity.
Okay, come on. There is a bipartisan trick that works on Americans like a charm. We are easily pushed into a cage, one on the right and one on the left. We lock in and then are unable to take in new information. We even throw rocks at people in the other cage and call them stupid. But both sides are prisoners, arguing about who is in a better cage. The information that we are given is curated. There are a lot of things going on in the world at any given time. We talk about and think about the things or perspectives that are given to us. I think that if you want the truth, you have to dig, and the truth is usually somewhere outside of those two cages, one on the right and one on the left. I hope that you are well. Take some time to strengthen yourself. Your immune system has had your back your whole life and is effective in killing harmful bugs. Eat healthy, exercise, have good hygiene, sleep more, take vitamins, especially D3, A, and C in this case, and laugh with those you love. This is old science, and there are many studies on immune system building if you want to look into it more. I love you all. Let's put aside our political stances and look for the evidence and motives in the world around us. Let's hunt for the truth.
What I really fear in the long run from all this are the political ramifications. That's what scares me. When one country in Europe now has a dictator for lifetime, and you see these black forces creeping out of the ground in many countries, that will be the remaining legacy of this outbreak, and it scares me.